You're saying that if you can't afford it, you don't get to have it, and that includes health care.
Yeah, just like if I want to go to the store and buy a new dress shirt, if I can't afford that dress shirt, I don't get to get it.
So what do I do in the meantime, sir?
Sounds like something you're going to have to figure out.
He was basically shaming me for not having enough income during a pandemic with a husband who's furloughed to pay for my health care. I was hoping that would be a light bulb to some of our legislators, that they would say, wait a minute, we are in the middle of a health crisis here, and we have hundreds of thousands of our population at risk of losing their health insurance. Let's come up with a plan of action immediately that will offer some relief. And quite frankly, it's been crickets.
Yeah, just like if I want to go to the store and buy a new dress shirt, if I can't afford that dress shirt, I don't get to get it.
When he started comparing it to a dress shirt, that was the point that I said, okay, that enough's enough. And it hurt me so incredibly.
But health care is something that people need, especially if they have cancer.
Well, you got to find a way to get it.
But I'm trying to find a way to get it, and I called you.
When I made this call, and this gentleman started telling me that if you couldn't afford it, you shouldn't have it. It's my patriotic duty to go without. I went through this range of emotions of anger and hurt and shame, actually.
What are the options for a North Carolinian that needs health care that hasn't worked since March? We've been paying it up to this point.
I'm not sure, but I think it's something you should look into.
I should look into? I've been looking into it. There is no other way. Once my husband gets back to work, we'll be able to afford it again. But in the meantime, if I don't pay July's premium, they cancel me. And then I won't be able to have insurance again until December when the new enrollment comes up. So what do I do in the meantime, sir?
Sounds like something you're going to have to figure out.
This is a 23-year-old kid who's been in my office for a couple of months. He was disciplined. He made a mistake.
That is not acceptable for anyone to be speaking to any constituent in such a manner. I'm not going to accept that I was spoken to in that way, and I don't think any American citizen should accept that this is the ideals of healthcare that might be generated within the hallowed halls of Washington, D.C.
Thom Tillis' office has nothing that they can add. They can say, I'm sorry, but they can't say we're working hard on healthcare, because right now they're trying to sue to defund and kill the ACA.
I'll do it every time it comes to the floor.
Thom Tillis needs to be put on notice right here, right now, that this is his responsibility. That didn't leave any safety net for us whatsoever. If something does happen and he does get sick or I get sick, there's nothing for us to fall back on. I've learned to speak up because I'm not the only one who is going through this. And that's what's shameful, is that I'm not alone. No matter who you are in this country, you should have access to affordable and reliable health care. That shouldn't be considered something that's a luxury in this country. It should just be there.